of our guests is Dr. James Rota. In addition to his general practice in dentistry, he is a lecturer and former assistant professor at UCLA. Let's talk a little bit about a question that comes up often at luncheons and parties. Do you know a good dentist? What are some of the qualities you find in the finer dentists that refer to you?
Yeah, that's one of the common questions that I think is often asked, and there are many, obviously, answers to that, and it does get into personal selection. But I think there's some generalities that you can use, and that I would use today in selecting a dentist. I think we might agree that certainly the dentist should be aware of cause and be aware of prevention. So there should be some established preventive program that they're associated with, whether it's delegated to one of the dental assistants or the hygienist. That certainly is one of the points. So see if they're involved in prevention and cause. And most, I think, is providing the time to communicate, because we know that the teeth are the result of symptoms that require an explanation. So I think a discussion is important. Time to allow to talk about why it's there, could I avoid it? And I think so communication is a very important factor. If that's available in the dental office, that's a good start.
Dr. Rota, do you think that alternative treatment plans are important? For instance, that the patient receives an estimate for an A plan, a B plan, and a C plan?
I think it depends on the practitioner. I think that you should give the person an opportunity, I think, obviously, to see if there's other selections. But I think sometimes if we put too many shoe boxes and give them too many alternatives, they become confused. And I'd like to present the optimum first and not to assume the person could not afford the optimum, and present that, and then find out if there's alternatives. Financially, reasons would cause us to go to the alternatives, but present alternative ways as far as the cases available or what types are available. But yes, I think they should be given an opportunity to select.
Dentists today are trained to do many different types of techniques, and continuing education programs involve areas such as hypnosis, acupuncture. All you have to do is look at the various bulletins, and you're kind of a pioneer in these areas. Why don't we talk a little bit about the various techniques you're doing?
Sure. As Cindy said, I think that one of the most important factors is fear, and I think the more we don't know, or the least we know, the more fear we end up. So I think communication is important. I think that's very important. And when we're talking about pain and we're talking about the mouth, all attention goes on the head and neck and the shoulder area. So what we've seen in the new age of awareness regarding the rest of the body as it associates itself with the mouth is the realization that it's often advisable to disperse the attention from one part of the body that can accentuate the muscles, accentuate the pull, accentuate the inability to get anesthesia. As an example, could be the result of very tight muscles. It could be alleviated by simply taking the person's hand. This is hoku in an acupuncture, and by taking this portion or just holding the client and say hello or touching, or hoku is a massaging of this area that would release the neck muscles. Mm-hmm. And so doing that, you could employ hypnosis without saying, Cindy, you are now going to sleep, which is sometimes not necessary. Sometimes just the attitude, the touch at a certain prescribed place can alleviate the stress that they're holding up in the head and neck area to allow more effectiveness in the restorative area.
Cindy, Dr. Rota, are you seeing a lot more stress-related dental diseases in your practice these days?
I would probably make the statement that we're seeing an epidemic right now if I were to take my 25 years of practice and become observing of the clients that you see. And we're seeing a lot of reactions to the fast lane of life living by stress that shows up in the teeth, that shows up in the gum tissues, that shows up in the shoulder areas, the neck areas. So as Cindy was saying, we hold on to a lot of aggressions, suppressions, so we hold on. So often the teeth are at the other end of that. They're at effect of a neuromuscular system that's holding back a lot of stuff that you'd like to say but you can't, or you've got something, anger inside you and you're going to take it out on someone, or a lot of times it's your teeth. So by exercising, aerobics, yoga, whatever the vogue might be, the vehicle to discharge is very appropriate and very worthwhile.
Just briefly in closing, do you see a lot of therapies, that is nutritional problems, if a patient isn't taking enough vitamins B or C? Are their gums more inflamed?
Right. There seems to be a susceptibility to the mouth, in particular to stress, and it seems to fall into the vitamin C, vitamin B area, the stress-related vitamins. So we see a sponginess of tissue as an example. The tissues are more spongy, they get swollen, they might get a little bleeding when you brush their teeth. So we see those are the signs as a result of not enough fibers holding the tissue down by the vitamin C therapy. So there's a lot of new validation that's becoming to be aroused in the medical community as to the effectiveness of taking that type of therapy. And we see a lot in the mouth because it's a good demonstrator, an early warning system of what happens to the rest of the body.
Well, listen, thank you both for joining us. Dr. Rota, thank you very much for joining us. And you remember, remind me I need a dental appointment. We'll be right back.